But suppose frequent shocks undaya, they better report to the closest cardiologist.
Hello, sir. Sir, എന്താണ് ഈ implantable defibrillator?
Yeah, so implantable defibrillators, the word is, the term actually tells us what it is. People are familiar with devices that actually we use in the emergency room. At least in movies and TV serials, they would have seen where patient who has collapsed, they are given shocks with 2 paddles and the patients are revived. So when a patient comes to the emergency room, if they are in shock or they have collapsed, the medical personnel assesses and then they shock and revive the patient. But let's assume this event happens at home. Either veetle edengilum undaya, you collapse. There is no way somebody can assess and you cannot shock. So these are devices which are similar to pacemaker except that the size korchu koodudalano. And these devices are implanted, and if you happen to have such an abnormal rhythm, the device detects and shocks and revives the patient. So these are essentially implantable electrical devices that detect fast rhythm, give a shock and revive the patient.
അപ്പോൾ ഈ ഡിവൈസ് കാരണം ഷോക്സ് അടിക്കാൻ സാധ്യതയുണ്ടോ പേഷ്യൻസിന്? ഇൻ കേസ് അങ്ങനെ ഉണ്ടാവുകയാണെങ്കിൽ അവർക്ക് എന്തെങ്കിലും ചെയ്യാൻ പറ്റുമോ?
So we select patients who need to be implanted device, like patients who are prone for ഇതുപോലെ abnormal rhythm ഉണ്ടാവർക്കും, somebody's heart pumping which is low, ഇവർക്കാണ് ഇത് കൊടുക്കുന്നത്. So we know these patients are at a risk of developing fast rhythm. ഇങ്ങനെ റിസ്ക് ഉള്ളവർക്കാണ് ഇത് വയ്ക്കുന്നത്. അങ്ങനെ ഇത് ഉണ്ടാകുമ്പോൾ ഷോക്ക് ഉണ്ടായ that's the purpose. So ചെറിയ പെയിൻ ഉണ്ടാകും. One shock they can wait at home. So essentially the device has done its job, it's revived the patient. But suppose frequent shocks undaya, they better report to the closest cardiology center.